Doctor, you mentioned in your hospital record the parathyroid glands. That is correct. And are those important glands? Yes, they are. They are situated behind the thyroid. Is that at the top and bottom of each lobe? Yes, it is, sharing its blood supply. Doctor, their position and number are variable, are they? Yes, they are. Although most people have 4, is that correct? Well, some people have 3, 5, or 6 parathyroid glands. And these glands, doctor, are small structures, and they secrete parathyroid hormone, do they? Yes, they do. Or parahormones, of which it raises the calcium levels when they fall below normal. Is that the opposite action to thyroid calcitonin? Yes, thyroid calcitonin hormone is with a total thyroidectomy, preserving the parathyroid glands, which is not always possible. Doctor, in this case, what happened? In this case, 1 or 2 glands are inserted into a muscle in the neck, shoulder, or non-dominant forearm, where they usually survive and function well. Doctor, in your hospital record you mentioned the early post-operative signs. Yes, I do. Signs of what? Of low calcium levels, hypocalcemia, which include numbness and pins and needles around the mouth. Are there spasms also? Yes, a spasm of facial muscles when the cheek is tapped over the facial nerve. Is that necessary? Well, if necessary, calcium is given orally or intravenously to make sure there's not a deficiency of calcium. Doctor, for thyroidectomy to treat cancer, lymph nodes in the center of the neck are removed. Is that correct? That is correct. And other nodes in the side of the neck are assessed and may be sent for immediate analysis to look for cancer cells. If present, these lymph nodes are carefully removed in a modified radical neck dissection. And doctor, if a lot of tissue is removed, what happens? Well, a drain may be inserted for a day or two to prevent a buildup of fluid, but this is usually unnecessary. Doctor, there is a recurrent laryngeal nerve involvement? Yes, the recurrent laryngeal nerves, which run on either side of the thyroid gland, control movement of the vocal cords. And do surgeons, doctor, take care to preserve these nerves? Yes, where possible, but they may have to be sacrificed if involved within a cancerous growth. In the case of a small thyroid cancer, less than 0.6 inches, that is 1.5 centimeters in a diameter, some surgeons may recommend leaving behind a tiny amount of thyroid tissue. When you say a tiny amount, how much, doctor? Less than 0.035 ounces per 1 gram to guarantee preservation of at least 1 recurrent laryngeal nerve. And do other surgeons also perform such a total thyroidectomy? Well, in post-operative scanning for evidence of new tumors, it is easier when no normal thyroid tissue remains to take up radioactive iodine. Doctor, there was damaging or removing of 1 recurrent laryngeal nerve in this patient? Yes, there was, and it leads to a permanent hoarse voice. Was there damage or removing both nerves required in this case? Well, we did a tracheotomy, which is a tube inserted into the front of the windpipe to ensure you can breathe properly. Permanent accidental damage to these nerves is rare, occurring around once in every 250 operations. Doctor, a minimally invasive video-assisted technique may be used, is that correct? Only to remove a small thyroid nodule that is less than 1.2 inches or 3 centimeters in size for immediate examination under a microscope. And does that mean a small horizontal incision is made, doctor? Yes, it is. Where bleeding is minimal. This is higher than for traditional open surgery. And Dr. Fat and the platysma muscle are carefully cut through, are they? Yes, and deeper strap muscles are moved aside with small retractors. How's that?
That's good.